From the beginning of the AIDS epidemic, men have gotten infected because they had sex with other men. So, a fourth reason AIDS is out of control in Black America is what it means to be gay and black. After peaking in 1992, AIDS cases in gay white men have steadily declined.
The Food and Drug Administration.
White gay activists, largely affluent and educated, were galvanized into action. From the earliest days of the epidemic, they protested, formed political groups like ACT UP, raised money, and forced policy changes which spanned everything from health insurance to faster FDA approval of experimental drugs.
I think that the governmental response to HIV happens because the people who are dying were white. Because even though they were gay, they were white, and they were male. And the power brokers in America are also white and male. And so on some level, there's an understanding that this could be my son, this could be my brother, you know, this could be someone in my life.
But in the black gay community, there has been almost no organized activism. And that's been a significant force in the spread of AIDS.
When you start talking about sex, there's a problem. And when you start talking about homosexuality, it's a real problem. Nobody wants to deal with it. I know a few communities as conservative as the African American community, extremely conservative, particularly around sex.
I ain't seen you in how many weeks now?
David Mailbranch is an AIDS specialist at Grady Hospital in Atlanta.
How's everything going?
He also studies the social and cultural forces that make life very difficult for black men who have sex with other men.
The image of black male sexuality being somebody who's hyper-heterosexual, big masculine physique, large genitals, all those kind of stereotypes that have come back from the times of slavery, that's kind of wrapped up in what black male sexuality is. Being homosexual or having same-sex desire is not going to be compatible with that.
It turns out that black men who are gay or bisexual sometimes decide to hide their sexual preference. Keeping homosexual or bisexual activity a secret is called being on the down low, or DL. The term refers to a man who presents himself to the world as straight, but has sex with other men and doesn't tell his female partners about it. As I mentioned at the beginning of this hour, the reporting on this crisis began last year by my colleague Peter Jennings. He sat down then with a group of black men in Atlanta, some gay, some straight, some bisexual, all HIV positive. They talked with remarkable candor about the realities of having AIDS in black America.
I had full-blown AIDS, and the support that I thought I would get from my family didn't get.
In the black community in America, is it wrong or looked down upon to be homosexual?
Absolutely, absolutely.
Why?
Because it's quote-unquote unnatural.
So is AIDS seen by some as a punishment for homosexuality?
Absolutely. One relative actually had the audacity to tell me that it was a gay disease and that I was an abomination to the body of Christ, that I should have never been born, and that I'm a disgrace to the family.
Yeah. The social stigma behind HIV is so prevalent in our community. People are afraid to come out and say, I'm HIV positive.
Do you think that the community would rather sit back and watch people die at an increasingly alarming rate rather than talk about it?
It has been my experience that that's what's going on. Even though I'm living a gay lifestyle now, I was married for 16 years and had infected my wife, and she felt like she couldn't go to her family to tell them. So for 16 years, my wife just went through this denial and shame, and she didn't want to take her medication, and she passed away last year, so.
The girl that I'm dating right now, I gave her HIV. And I feel really bad about it, and things just went wrong, but I didn't tell her till a year later. And that's the sad part about it. And, but she accepts it. She
Doesn't have much choice, does she? If there are any number of black men on the down low having sex with men and getting infected and having sex with women and not telling them they've had sex with men, a lot of black women have been infected unknowingly.
Are you suggesting that the group of us are going out intentionally infecting people?
Well, I think in the case of Kevin, he knew his sexuality and he didn't tell his fiancée.
Again, who do we go to say I'm having these feelings? I can recall talking to a group of women and asking them if their men or their husband actually came to them and said, I sleep with other men. How would they feel about that? And a lot of them said they didn't want to know.
And do you think your experience coming out as a gay person is a common experience?
I think a great majority live with more of a down low life. It is expected from the community, from the family, from the church that men, black men in particular, marry, have families, have children, live happily ever after.
You blame men?
I absolutely blame men because the new infections for women are overwhelmingly as a result of heterosexual transmissions, let's face it.
A few months after Peter's discussion with the men, we gathered a group of women to talk about many of the same issues.
This whole thing. We trust and love our men deeply, and they are not being honest. They've embraced a lifestyle called the down low, which allows them to say, oh, I'm not gay, I'm just kicking it with my boys, which allows them to still be a man over here and be with their boys over here, and we're spreading it like wildfire. Another log on the fire, another log on the fire. But sisters have got to know that we have got to protect ourselves at all costs.
Right. But is there discomfort talking about HIV/AIDS in the black community?
I mean, for us to sit down and just have a circle like this, it just does not happen.
The women who are infected and the women who are affected have been silent.
And when you talk about African American, you're talking about generations of abuse. And we're talking, going back, we were talking earlier about the secrets, you know, and it's not just a black people's secret, it was a slavery secret. Because you didn't tell when Master came and got somebody out of the house, or and it wasn't just Master, it was the son, it was the sharecropper. You didn't tell, you know. So it's the same thing. We didn't tell. We've lived with these secrets and we haven't told.
I think for a lot of white people who may be listening, they're going to say, that was a long time ago. Do those patterns, do those forces still live and still shape your life?
Let's talk about it. But let's talk about it.
The fact of the matter is that we still live in that culture. So we don't discuss that our sons have HIV or our uncles or our brothers have HIV or our daughters are infected.
Right,
How do you address these
So
questions?
there's a 20-year-old, say, and she's about to go out on a date. What does she need to know?
20 questions. Do you have a girlfriend? Do you have a boyfriend? Have you ever had sex with a man? Because some men will say, no, I don't have a boyfriend, and say, no, that I'm not bisexual, but still they've had a sex.
When you go out, is this on your mind?
Oh, yeah. But I don't know that it's on every 24-year-old's mind.
Did you ask your boyfriend to get tested?
Yes. Let's do this,
How did he respond?
It's fine with it. Nothing to hide, apparently.
Yeah. She did that because she respects herself. And I guarantee you he respects her more.
And that brings us back to the bottom line. How do we reduce the numbers of HIV cases in the African American community?
We have to be a force to be reckoned with. However it has to it has to happen, because it's not going to get better. It's not going to get easier. We'll be here 3 years from now, a little more gray hair, a little less hair, a little more skin, having the same conversation if the black community don't stand up and adhere now. They have to adhere now.